or get right in the document. Oh.
Good afternoon, everyone, and welcome to today's presentation on COVID-19 and the Americans with Disabilities Act. My name is Mike Wilby. I am the Strategic Partnerships Manager at Disability Rights Connecticut, also known as DRCT, and will be today's facilitator. My pronouns are he and him. I'm a Black male. I have on black rimmed glasses, and I'm wearing a white with blue stripes button-down shirt, light blue tie and sweater with black pants. Before we get started, I would like to discuss a few housekeeping items. If you have a question or comment, please use the raise your hand feature and you will be unmuted by the moderator. It can be found in the reactions icon at the bottom of your screen. Please remember to introduce yourself before you speak. If you want to hear the meeting in Spanish or traditional Chinese, please click on the interpretation icon at the bottom of your screen and choose either Spanish or Chinese. There will be a real-time captioning in English. Interpreters for the following languages, American Sign Language, Spanish, and traditional Chinese are being provided. Make sure you are in speaker view. If you experience any difficulties accessing any of these accommodations, please put a note in the chat and we will respond as soon as possible. Finally, if you have a general question, please send it to the chat box as we will and we will try to respond to it. I'd like to begin today's presentation with the land acknowledgement. For those who are not familiar with that, a land acknowledgement is a formal statement that recognizes and respects Native peoples as traditional stewards of lands. The statement highlights the enduring relationships between Native peoples and their traditional territories. The statement that I'm about to read comes from the University of Connecticut's Native American Cultural Programs. By acknowledging that the land on which we gather is the territory of the Mohegan, Mashantucket Pequot, Eastern Pequot, Scotticoke, Golden Hill Pagaset, Nipmuc, and Lenape peoples who have stewarded this land throughout the generations. We thank them for their strength and resilience in protecting this land and aspire to uphold our responsibilities according to their example. Thank you. Our speakers for this afternoon include Debbie Dorfman, Executive Director and Attorney for Disability Rights Connecticut, Kathleen Flaherty, JD and Executive Director for Connecticut Legal Rights Project, Bonnie Roswig, JD and Program Director at the Center for Children's Advocacy, Walter Glum, Executive Director for Connecticut Council on Developmental Disabilities, Amy Watt, Donna Cohen, and Dr. Rand Paul. At this time, I would like to turn things over to our first presenter, DRCT's Executive Director and Attorney, Debbie Dorfman. Debbie?
Thank you, Mike. Welcome, everybody. We're very happy to have you here today. This is the first of a series of 9 disability rights webinars that the Connecticut Legal Rights Project, the Center for Children's Advocacy and Disability Rights Connecticut are doing together in partnership with a grant from the Connecticut Developmental Disabilities Council, for which we're greatly appreciative. And today's webinar, as you probably can guess from the title on the flyer, is about disability rights with respect to COVID, particularly the rights of people with disabilities under the Americans with Disabilities Act on a variety of issues that pertain to COVID. And we'll start out today with Bonnie Roswig from the Center for Children's Advocacy, providing you with a brief overview of the Americans with Disabilities Act. And then we'll go on to talk about some various different cases and advocacy efforts that have gone on here in Connecticut relating to enforcing the ADA rights of people with disabilities in the context of COVID. And so with that, we'll go ahead and start, and I'll turn over the presentation to Bonnie.
Thank you so much, Deb. Good afternoon, everyone, and thank you so much for joining us today. I'm going to talk to you just very briefly about the Americans with Disabilities Act. you know, we all see, experience, and hear incidents which really have a really concerning effect on people. But it is more than these things are just, it's not just that these things are bad or wrong, but really they are a discrimination that should be prevented by the law. So I'm going to talk about two parts of a very specific law today, and that is two sections of what is known as the Americans with Disabilities Act. And Marissa, are you going to start the slides, please? Okay, great. So you can go to the fourth slide. Great, there we go. So I hate to bore you all with legal language, but I have to say that I really think this is such an important law, and its words are very powerful because they really talk about the protection that people with healthcare conditions are required to have. And it's a federal law. That means it applies not just to Connecticut, but to the entire United States. And it's called the Americans with Disabilities Act. So I'm going to talk about two sections today. And the first is what we call Title II. And the language of that act says as follows: no qualified individual shall, on the basis of disability, be excluded from participation in or be denied the benefits of the services, programs, or activities of a public entity or be subject to discrimination by any public entity. You know, think about that. No qualified individual shall, on the basis of disability, shall be excluded from. So what specifically is this talking about? Slide 2, please. Next slide, please. So Title II talks about government funded programs. So schools, childcare that's funded by the city, any municipal program. And what these programs are absolutely required to do by the law is provide reasonable modifications. And what that means is that they should provide changes, modifications to ensure that people with healthcare conditions can participate in those programs. Next slide, please. So what specifics are we talking about? So for example, a child who requires the administration of medication during their day, the Americans with Disabilities Act says that that program has to include that child. And I apologize for using the child context. I work for the Center for Children's Advocacy, but obviously this law applies to everyone. So you can't exclude children exclusively because they have a cognitive, mental, or behavioral health diagnosis. And that also fits into more of the things that we're going to be talking about later on in the hour. You can't implicitly exclude people with disabilities because they can't access a COVID-19 test kit on a first come, first serve, because that's impossible based on their healthcare condition. So the next slide, please. The next section of the Americans with Disabilities Act that I'm going to talk about is what we call Title III. The language is very similar. It is that really strong language that exists to protect all of us. And it says, no individual shall be discriminated against on the basis of disability in the full and equal enjoyment of the goods, services, facilities, privileges, and advantages of any place of public accommodation by a private entity. So what exactly does that mean, and who does this apply to? Next slide, please. So this is private sector. You know, lots of people think that, you know, protecting people with healthcare conditions only applies to government funded facilities, and that's just not true. It's the entirety of the public sector. So again, you can't say, nope, someone has a physiological condition, so they can't participate. Someone has a cognitive, mental, or behavioral health diagnosis, they can't participate. No, that absolutely is not correct. And also, if someone needs medication in the course of their day, they can't be excluded. Next slide, please. So what do we mean by reasonable modification in the context of the Americans with Disabilities Act? Well, it's really based on what this individual with a healthcare condition needs, because we're all individuals. So healthcare conditions are unique to the individual. The impact is unique to that person. And therefore the modification, whatever changes that person needs, is unto themselves. And so there is no blanket denial that, as I said earlier, is appropriate. And there can be no fixed laundry list. No, we will only provide certain modifications. Next slide, please. So what are examples? So for the individual with diabetes, particularly for children, schools, camps, daycare centers, they have to provide diabetes oversight, and that includes providing insulin. Or children or individuals with behavioral health issues. The starting point of any program should and must be inclusion. And we attempt to figure that out by doing what's called an individualized assessment. What does this individual need to support their participation in the program? Next slide, please. Now, unfortunately, there are limited exceptions to the Americans with Disabilities Act. They are fundamental alteration of the program, undue burden, and direct threat to health and safety. Just very briefly, fundamental alteration is, if a program, for example, a camp program, is a combat wrestling program, that's all they have, that's their only program, and a child has mobility issues and is at risk by physical interaction, the program is not required to provide an alternative. But a basic camp program where there are lots of sports, modified programs should be required. Undue burden, that means that it is very expensive to provide this modification. But I have to tell you that if a facility says, oh, we don't have the money to support that, then the Justice Department, who is one of the federal agencies that oversees this program, will say to that entity, okay, open your books and show me why you cannot afford this. And then the third is direct threat to health and safety. If an individual is very aggressive, then chances are a generalized program is not going to work. So that is really the Americans with Disabilities Act in a nutshell. Just one more slide, please. So obviously COVID has a number, we've all seen, many concerning policies based on COVID that we feel violate the ADA. And we're going to talk more about those today. Next slide, please. So I'm not going to go through the cases. The Center for Children's Advocacy has brought a number of situations to the attention of the Justice Department. They have been successfully decided on behalf of the individuals that we assist. Programs have had to change their policies, change their procedures, include individuals with healthcare conditions, and pay financial damages. And a financial incentive is always something that works well to get someone to comply with the law. But as a bottom line, there are many situations where
Thank you, Bonnie. We wanted to provide you with some examples of some of the advocacy that we have been doing regarding disability rights and anti-discrimination in the context of COVID. And we thought we'd first start out with some advocacy that Disability Rights Connecticut and a number of its community partners did back in May of 2020, really when COVID first started, or soon thereafter. And that issue was with respect to the rights of people with disabilities to have support people accompanying them when they were in the hospital or receiving outpatient services and other similar medical services. What happened in that situation was that the state issued, the governor's office issued a mandate that, or a guidance, I should say, back in 2020 that said, that basically allowed for the restriction of visitors in these types of settings and disallowed support people or other individuals who a person with a disability would need to have help them in the hospital or in these types of medical settings, and except for people who were receiving services from the state developmental disabilities services. And so this, of course, was clearly discrimination against all the rest of the people with disabilities who needed, as a reasonable accommodation, to have support people with them in order to have equal access to get medical care. There was also another complaint that was filed against Hartford Hospital for a similar problem with respect to its no visitors policy. And that complaint was filed on behalf of a woman who needed to have her support people with her in order to be able to get the care she needed. And so as a result of these complaints, there was a mediated resolution. And as a result, what ended up happening was that the state agreed to issue a new guidance that explained that people with disabilities, all people with disabilities who needed a reasonable accommodation in order to have access to medical care during COVID, including bringing a support person, would have the right to do that, and also issued a statewide policy requiring hospitals and other acute care settings to permit a designated support person to accompany an individual with a disability to get the medical services that they needed. So this is just one example, and we'll be talking about some other examples in just a moment. So I'm going to now turn it over to Kathy Flaherty, who will talk about some other, and our other speakers who will also provide some other examples of work and advocacy done with respect to access to the COVID-19 vaccine.
Thank you so much, Deb. And I want to welcome several other people to participate in this panel discussion with me. They include Donna Cohen, who is a mom and advocate of a 29-year-old daughter diagnosed with autism and intellectual disability. Walter Glom, who is a parent of an adult who lives with developmental disabilities and is also the director of the Connecticut Council on Developmental Disabilities, and Amy Watt, who is the assistant director of the Vernon Parks and Recreation Department, who managed and provided logistical support to clinics at the Vernon Senior Center and Rockville Hospital, and was the project manager of the disability vaccine clinics. You will also see a video from Dr. Daksh Rampal. I will put his name in the chat. He is an emergency medicine physician and the chief executive officer of Priority Urgent Care. He could not be here today, so he recorded a video that we will be sharing with you in just a few moments. I'd like to start by asking Walt and Amy the question of the need you identified and why you realized, or when you realized, that you would be part of the group of people to help address those needs. And then I'd like to talk to Donna about the challenges she faced. Then we'll see Dr. Ron Paul's video, and then I'll come back to the three of you for a follow-up to that.
Okay, thank you, Kathy. I'll start off. The real story needs to be told by Amy and Donna, but I'll just give you the context. Again, I'm the director of the Connecticut Council on Developmental Disabilities, and we're a federally funded agency that is here to assist Connecticut in creating better community-based options for people with developmental disabilities. Last year in the spring, the federal government offered us some special funding to improve access to vaccines for people with developmental disabilities. We did a quick survey of our advocacy partners around the state and learned that individuals with behavioral conditions, autism, some psychiatric conditions, were not getting the accommodations that they needed in order to receive a vaccine in the existing system of mass community clinics. I started talking to the health directors and the social service directors in the towns in my area to ask them how they were handling this issue. And they all pointed to Vernon as best practice, and where somebody was doing something that was really helping. So the council gave a grant to the town of Vernon to manage a special clinic and develop the accommodations that these folks needed. And I'm pleased to say it was very successful. We demonstrated that this can be done. And we're now working with the State Department of Public Health and other entities to see that these best practices are disseminated and they'll be available anywhere in Connecticut in the future. And with that, I'll let Amy tell her story.
So hello, welcome. Thank you for having me here today. I'm Amy Watt and I'm with the town of Vernon. As Walter said, that we had been running large vaccine clinics pretty much a year ago this week. We started off and we were running clinics up to 800 people a day. And when Walter came to the town of Vernon, we were very interested in helping and reaching those pockets of individuals that couldn't come to the clinics that we were running because there were a lot of people out there. And we were doing accommodations at our clinics in as much as a large clinic could handle. But it was this group that needed help. It wasn't even easy for a lot of the people that came through our doors at the large clinics to get vaccinated, let alone ones that physically, mentally just could not do that seen. I will say it's a huge partnership. Yes, I led the project, but Walter was a huge help leading me into areas that I'm not an expert by any means in this field. Like I said, I'm a Parks and Recreation director. I do understand the day camp aspect of things and including individuals, but I never thought I'd be running clinics, and this was very new to me. But having the resources and reaching out to people that can help is key. There's a lot of people out there with a lot of knowledge that can help us out, and my skills were skills I could put it all together. And it was a wonderful thing. It was a very rewarding. I loved every moment of being able to help people. And it took a lot of time. It took a lot of communication. And really, as mentioned before in slides, how every individual is different. And to really learn all those individuals individually, knowing what their specific needs were and to make them all work. And like I said, it was very rewarding. I'm glad to hear that it's Walter saying it's expanding out to reaching out to health departments to be able to take what we've done and make it all across the state. I mean, I will say I went from Vernon to Easton to help someone too. So we reached out to a lot of areas that didn't have the ability to do what we were doing. And so it's good that it's not just, it's spreading around the state, and that's wonderful. And it was wonderful. I know we have Donna here who, I can pass along to her as she knows. It takes a lot. It takes tries. There's try A, try B. Some things work, some things don't work. And it's something that you learn as you go too. So I can let Donna, if you want to talk about your experience with us, that'd be great.
Sure. So I'll just start with the challenges. There were kind of three things that I thought about when I was thinking of this today. One is Rachel herself she has behavioral issues, especially when she gets scared. She has never been a fan of shots. She hasn't had a shot except for this one that was finally successful since she was preteen, when you need them for school. So it'd been a long time. And when she gets scared, she can yell and scream. She can pinch. She can try running. She could push somebody away. So we were very concerned about not only her safety, but the safety of the people who were going to be working with her. Another challenge is in these situations where Amy was talking about 800 people a day, they were giving people maybe 10, 15 minutes apart. That was not going to work. It could have taken us 20 minutes to walk in the building. And also, to be honest, in the world of people with cell phones and access to cameras, we were concerned that if she had a behavior that somebody would misinterpret it or just think it was funny. Haha, let's go put this on YouTube. And that was a huge, huge concern. That kept me up, actually. That was a big concern. The other part of this is that she really had no understanding of what was happening. She is verbal in terms of very concrete things, but her abstract concepts are not there. So she does not understand, even to this day, what a pandemic is. We could not explain that a vaccine will keep you from getting sick. That makes no sense to her. So there was really no reasoning. We were just going to have to do this because we felt that this was the way to keep her safe. So that was a bit of a complication. The next challenge was finding the right person who could give her a vaccination. And we needed somebody willing to work with a person with significant disability and who was unpredictable in her behavior. We needed them to be willing to work with staff people who were trained in physical management in case that was a necessity. That can make some people uncomfortable. Then the next problem was finding the setting, which I explained needs to be private, no crowds. Also, loud noises can be an issue here or there. But also having the time, we didn't want her to scare another little child waiting if she got loud. The time allotted needs to be better. So those are like the three major challenges we were working with. Kathy?
Yep, thank you so much for introducing and kind of really setting the scene for what makes those vaccine clinics work. And Dr. Rampal, who was the medical person at a number of these clinics, did record this video. Marissa's going to bring his video up and play it. You will be able to see in the middle of your screen, you can toggle and make his video smaller or larger, especially if you need to see the ASL interpreter.
Hi, I'm Dr. Rampal. I'm the medical director at Priority Urgent Care. We provided the medical supervision and the medical know-how for these clinics.
And how did you get involved in the clinics?
When Town of Vernon brought this to our attention, that there was this wide vaccine gap, we realized we were uniquely positioned to be able to help folks get their vaccines. We had the know-how, we had the training, and we had run clinics, so we were very confident that we would be able to help.
What were some of the major challenges you faced?
When these clinics started getting popular, more and more people realized we were involved, and a lot of times people would reach out to us directly. At our urgent care clinic, we did not have the right trained staff, people who are trained in PMTs, to help us in our clinic. There were a lot of folks who were not known to have disabilities who needed help with vaccination, and this was challenging. We had to make sure that we were able to take everybody who needed vaccination, and we wanted to get them all vaccinated. So this was challenging for us.
What would you do differently?
We would certainly have more PMT trained individuals. And I think in the time that we had in the big clinics, we could have taken more patients. So we were, I think, spreading them out too much. We could have tried to do more patients and make sure that we have PMT trained staff and willing to use them more readily.
What lessons did you learn from this?
I think there is a real need for this, and more people should be involved, and we should use our combined strength to get more folks vaccinated.
I just want to thank Dr. Rampal for taking the time to record that video so that he could participate in today's webinar, even though he couldn't be with us in virtual space at this time. And what I'd like to do is start with Donna, then go back to Amy and Walter. Now that you've heard what Dr. Rampal had to say, what worked for your family? And maybe what still could have been better? And what lesson do you hope other people will take from your experience?
So what worked first was Amy. The communication was incredible, and it took off such a burden on my shoulders. All I needed to do, she just said, all you need to do is show up with Rachel and we'll take care of the rest. And she meant it, and that's exactly what happened. So instead of having to have conversations with 4 different people, she took care of all of that. We also felt like we were always updated. We were always in the loop. As parents, sometimes, I don't know, people get nervous around us or they get annoyed with us. But in this case, it was just a very comfortable conversation. She asked all the questions she needed to and asked me to ask her questions as well. They set it up so that it was truly an individual situation. So they said, for example, do you think she'd like to have a therapy dog with her? Do you think she would like to have a weighted blanket? What kind of videos does she like? We have a big video screen. We can put on her favorite music. Is there a snack that she might like to have afterwards that we can kind of show her? Is there a special place you think it was just amazing, like so many questions and very thoughtful about what she would need. And then the other piece of it was just the comfort level of having somebody say to us, do you want to stay here with her or do you want to go down the hall? Now, I know that sounds like a crazy thing, but as a parent, I always sort of feel obligated to stay with her for these sort of things. But the truth is, this was freaking me out horribly. I was incredibly anxious. We had already had one failed attempt at our home one evening. So this was sort of, to me, like the do it or it's not going to happen moment. And my gal does feed off my energy. So I took the go into another room way. And I think it was better for her, not just good for me, but truly better for her. And she surprised us all. I mean, she just went right in and she went with people she didn't know. And I introduced them to her as her new friends. And she was very comfortable sitting where she was sitting. And everything also happened very, very quickly. It was within 10 or 15 minutes that they came down and said, come on out, go sit with her and have her snack and whatever. I couldn't believe it, truly. I thought this was going to be such a to-do, and it went very smoothly. Part of that also was Dr. Rampal, and Amy both were very calm, and they didn't seem nervous to be around her. They didn't seem nervous about the situation. It was great. So in terms of what could be better, to be honest, for us, that experience could not have been better. It was a huge success. She was not upset after. She got in the car, said bye to her friends. It was mind-blowing, actually, for my husband and I. We never expected that. What could be better? Generally, I would say when we tried to do the booster, I of course called Walter and said, "Hey, are you doing those things anymore out there in Vernon?" And he said no. And I just thought, now what am I going to do? So I emailed Dr. Rampal. I still had his email, and I said, "Would you be willing to see her at the clinic?" And he said sure, and we set it up. And then I went back to the state, and I ended up doing all this stuff that Amy did that took forever to organize. So I don't know how she organized this for so many people. It was truly exhausting, between trying to get people to support her at the same time that they were going to be available at the clinic. So that was a very frustrating situation, the follow-up to it. We ended up, by the way, doing that one in the car. We went to the clinic. It was crowded. The room was too small if there was going to be a problem. Again, the people with potential to take videos. So there you go, just made the switch, did what we needed to do, came out to the car. 2 seconds, like 1, 2, 3, we rolled down the window, she got her shot, and off they ran, and that was it. So that part was good, but the not good part was that this was not available, that everything was, back to like kind of where we were. And I do think that that's just the larger picture, is that in general, we need to have medical systems, and including dental and mental health systems, that are set up for people with disabilities. And we need to train medical people better, or at all. I don't honestly know what training they get. And we need to work out insurance issues, trying to, get them to take the insurance that we have. So it's not $1 million to go get a vaccination. Well, in this case, you didn't have to, but just in general, I think we have a long way to go in terms of people with disabilities and the medical system. Those are my thoughts.
Thank you so much, Donna. I'm not sure if either Amy or Walt wants to add, like, within, rapid fire 1-minute roundup of what lessons you learned, what you referred to a little bit, Amy, but I don't know if you had any final things to add after hearing Dr. Rampal and Donna.
Well, one, I'm glad to hear you were able to get a booster shot. I am sure it was a challenge, and it's hard for me not to help, because I know others have come our way asking, for continuing. So I'm glad that Dr. Rampal was able to help. And I know that some of the vaccinators that we had working for the town of Vernon have now actually gone over to work with Dr. Rampal. So anybody who has reached out to me again, I happily refer to him, because he obviously knows what's going on. And I know he has the staff that we trained. And thank you for all the positive things you've said, Donna. It is really nice to hear. And I felt that the whole system has gone really well. And as Donna mentioned, it does take a lot to go through, but it was worth it. And I'd almost say, like, when we were scheduling an hour for an individual, I think by the end of doing our clinics, we were down to a half hour, which is still a lot of time for one person to have to be designated to a half hour. A challenge, I would say, though, looking ahead for others, that I would say that we ran into at the end was, and we didn't do this, but I would say for future, for people needing to do this, is shot number 2. And because we were accommodating those who needed the Pfizer, who needed the 2-shot series, when it was the 1 shot, it was very great. Come in, we have this wonderful scene, that they like XYZ, they come in once, meet new people, we're all lovely, and you're vaccinated and on your way. Now we had to deal with children that had to come in for round 2. I would probably say I would recommend for the future to do a different round 2. Each of the children that came through it was successful, but it did take a little longer, because even though they had only been to that facility once before, and we might have changed things up a little bit, it's still brought back. I mean, they're extremely intelligent individuals and very smart. And, you know, you can't fool them thinking that they could come into this building and thinking that it was not going to be the same scene again. So that's just a recommendation I would say for the future. If there is even another entrance to the building we could have used with a different room, or trying to do the car. Some people, that was successful. Some people going to their house was successful. Everyone was so different. But with a second shot, that's just something to consider.
Thank you. Walt, any final comments for this?
I'll be quick. I'll say, for my part, the message I'm taking to the state and the public health system now focuses on the communications piece. The first thing that Donna mentioned. The way the system was built, there was no way in VAMS or any of the appointment systems for CVS or Hartford Healthcare or whatever, for people to raise their hand and say, hey, I need an accommodation, getting back to the ADA, okay? These systems they must, I mean, by law, but as a moral imperative, they must provide accommodations to individuals. And there was just no way for people to ask. There was no place to check. And what we really need on the front end of the system is a way for people to identify themselves and talk to a human being. Now, Amy was terrific in providing accommodations, and they tended to be extra time, extra space, you know, the capacity for PMT certified staff and so forth. But really, that's all details. None of that can happen if you're not listening to people. And the system had no way to listen. So that's what I'm working on now is finding a way to build, modify the system so that the next time we do this, whether it's vaccines or tests or whatever the next big thing is, that people have a way to contact someone who's going to listen the way Amy did and take the time to communicate and understand the specific needs of that individual, because that's what's required by the ADA. And currently, we really don't have that in the system. So there it is.
Thank you all. I really appreciate you showing how to make this real. And what I'd like to do at this point is bring Debbie Dorfman back to talk about what was really a joint effort between Connecticut Legal Rights Project and Disability Rights Connecticut to make sure that people with disabilities had access to the at-home test kits and N95 masks that municipalities started distributing, along with access for people in state-operated facilities. So I will turn it back over to Deb Dorfman.
Thanks, Kathy. So as Kathy mentioned, CLRP and DRCT recently partnered in another advocacy initiative in order to make sure that people with disabilities had equal access to the N95 masks and the test kits, both in the community and also to have access to the N95 masks for people who were in state-operated facilities. And this advocacy is actually pretty recent in the wake of the most recent surge of COVID. The Omicron, as everyone knows, was extremely and is extremely transmissible. And we learned that the masks that we've been wearing for all this time were not effective and that we really needed N95 masks. And so what happened was just a little bit before New Year's, we learned that the state had issued some guidance around distributing the test kits and the masks, and also that they were going to be providing test kits and masks to the towns, and then they in turn would be distributing them for the most part as they pleased. It turned out that the initial guidance that the state gave was, you should consider, vulnerable populations, but really no directive requiring that, and certainly no requirement around providing reasonable accommodations whatsoever. So as a consequence to this, the towns started to distribute the masks and the test kits in a way that was really unfair to people with disabilities, because they basically, for the most part, were distributing them first come, first serve. And so it became sort of like the situation you have on Black Friday after Thanksgiving, when people are racing in to get the TV at Best Buy, and waiting there, and the first person who gets to the TV gets the great deal on the TV. And so obviously this was not viable for many people with disabilities who, for whatever reason, because of their disability, might not have been able to go to the site to pick up the test kits or the masks, or not be able to go at the times that those were available, or any, there could have been any number of barriers to get the masks or the test kits. And by the time they got there, they would probably be gone. And so that was one set of issues. The other issue is that we got more and more complaints about from our clients and constituents and family members of those individuals who were living in state-operated facilities. And this includes people who are in the Department of Corrections custody in the state prisons and jails, people at the state hospital, people in facilities operated by DDS, and other types of facilities operated by the state. The complaint was that people were not getting N95 masks. And the complaints varied from some of the reasons given for not being able to get the masks were because they either didn't have them, or they were considered dangerous, and because they have little metal pieces. Some of them do, not all of them. So there's a range of reasons given. And so we wrote a demand letter on New Year's Eve, and asked that the state immediately revise its guidance so that there would be a way for people with disabilities to get accommodations, and to direct the towns to have a process to do that, and to make sure that they prioritize people who are vulnerable, so that they would have equal access to the masks and the test kits. And we also asked that the people who are in the state operated facilities be given equal access to get the N95 masks. Unfortunately, that letter didn't resolve it. And so a week later, we ended up filing a complaint with the United States Department of Justice, and also concurrently with the Office of Civil Rights. And then soon after that, the good news is that we were able to work collaboratively with the state and quickly resolve the problem. And we were really very appreciative that we were able to do that. And the governor's office agreed and did in fact change their guidance. And as a result, the guidance now provides that the state the towns must prioritize the vulnerable populations in terms of distribution of masks and test kits. And also each town is required to have a process by which people with disabilities can ask for reasonable accommodations to obtain the PPE, the masks and the test kits. And finally, that they have to have an established phone number that people could call to request the accommodations. In addition to that, the state agreed to ensure that that people who are living in the state operated institutions, they were going to distribute 20,000 masks. And by sort of calculating who was in the state's custody, that seemed to cover it. That does include the Department of Corrections, as well as DCF facilities for children, and the state hospital, DDS facilities, and really any state operated facility. So we were very pleased with the outcome, and as a result, we were able to withdraw our DOJ and OCR complaints. This was a really good example of how the ADA can be used to advocate on behalf of people with disabilities in the context of COVID. Just one little thing, because I know we're running out of time and I want to make sure there's time for questions. But at the end, there were still a few, even though the governor revised the guidance, there were a few towns that were stragglers and didn't comply initially, but we were CLRP and DRCT once again were joined forces and were able to successfully advocate and work collaboratively with those towns to get the changes that were needed. So with that, I know that we're running short on time, so I want to make sure that we have, we open it up to folks in order to take any questions or comments. So, I think there were a number of questions perhaps in the chat.
And this is Kathy, just a reminder that you can use the raise hand function in the reactions if you have a question, and we can take you as a participant off mute and have you ask your question live, or you can type it into the chat.
I do see Annie has their hand raised.
Hi, I'm Annie Dance. I'm a former commissioner from Danbury Commission for Persons with Disabilities. And I'm a deaf individual and use closed captioning. And my question is there any guidance that you know of other than the ADA to essentially enforce the ability to have closed captioning? I know the governor in his press briefings has done it sporadically, and that's of course limitations of some technologies, but from my digging, my research, I'm a journalist by trade, my understanding is really the FCC has the guidance, but it's one of those things where they can claim undue burden or claim some expense, but at this day and age, closed captioning is really needed.
I'm sorry, I'm having a little bit of trouble with the computer. Do you mind just repeating the last part of what you were asking? I apologize.
Hi, I'm sorry, I might have some connection issues on my end. I'm asking about closed captioning. Is there any enforcement or guidance that you can suggest to have better access to closed captioning? For example, with the governor's daily press briefings, it's been sporadic, and I find it on YouTube. Once the link's posted, YouTube has closed captioning, then I'm able to view, but that's something that I've encountered throughout this pandemic, and I imagine other people who rely on closed captioning have as well.
So, I mean, and others might have different view, but I mean, I think one thing that you might want to do is write to the governor's office and request that they improve the captioning so that it's consistent, so that you have access to it. That would be one option. And you may have already done that. I don't know.
I have. Yes, I have.
Okay. And depending on their response, there are other options that you can do. There is the state has their own anti-discrimination enforcement agency called CHRO. You can always file complaints there, or you can also file complaints with the U.S. Department of Justice. And I think Bonnie may have a comment.
Yeah, I wasn't going to speak directly about that, but language translation and certainly closed captioning, the standard for the ADA is reasonable modification, and closed captioning is nothing new. It's not a radical concept, and I think that contacting the CHRO or the Civil Rights Department of the Justice Department, the local U.S. Attorney's Office, they would be very interested in hearing that this isn't being done particularly on a state level, particularly the municipal responsibility. I just wanted to also mention really quickly that, you know, in the context of what is a reasonable modification, when Amy described what they did, or what her recommendations are, I mean, that's the quintessential reasonable, right? Go through a different door, go into a different facility. This isn't anything radical. It doesn't, you know, there's no parade of the horribles around how much it's going to cost to do it. It's just, it's sort of some of it takes more effort, but it's the, let's start with how are we going to make it work for this person with a certain diagnosis. And that, you know, Amy's examples were great and really sort of classic examples that if someone just steps back and thinks about, you know, what it is that would work, what can we modify about the way we do things, then it really sort of, you know, fits the definition of reasonable modification.
I think maybe we have time for maybe one more question.
I see that there are two hands raised, Lena Esposito and Siobhan Morgan. And maybe we should just have each of them very quickly state their questions and then try to answer them. And hopefully they may be related and it can be combined in one thing.
Okay, thanks.
Hello. Yes, and this is my question. You know, I know that a lot of people right now, like I have my daughter has multiple disabilities, and we go to all kind of specialties and doctors. You know, and of course, she's having a lot of virtual appointments because the doctors, they don't want to get exposed to the virus, to the COVID. And the problem is that there are too many virtual appointments. And then the doctors also, they go outside and they have of course, the regular life. Then now they don't want to see the patients. You understand what I mean? Then now it's a problem because I know that they don't want to be exposed. I know that the patients, when I go with my daughter, we always wear a mask and anything like that. But this is passing through the other side. That is I don't know if because maybe it's shorter doctors or anything like that, but this is creating a problem. It's so bad that not even they want to see the patients for gynecology. It has to be virtual appointment first, and then you have to wait for the patient to see you virtual, then you can have the appointment. Then you see how bad is this one, that of course we want to protect ourselves, we want to protect our children, but this is coming like now like crazy in the medical system. And then when you have a special child that you need a lot of medical attention, this is another problem that now we have to add it to the COVID. Thank you.
Siobhan, did you want to?
I'm muted. Hi, I'm Siobhan. I work at Disabilities Rights Connecticut, and I did put a link to our website in the chat where we have COVID information and some links to some helpful information. I just wanted to get that out there. Thank you.
Thank you, Siobhan.
Deb, did you want to address Lena's question?
So, you know, I think it's a, you know, in terms of access to getting services, it's kind of it can be complex because there are figuring out like the sort of the availability of the providers and the, you know, being able to have timely access. What I would say is, I think in this situation, it really kind of depends on the individual circumstances and what is needed. If you need in-person services as an accommodation and that the online is not working, then I think it's important to make sure to let the healthcare provider know that and to provide and request a reasonable accommodation. And if you need more information about how to do that, you can call Disability Rights Connecticut and go through our intake and we can provide you with some information about that.
Well,
Kaylee just provided that information.
well, it looks like we hit our we hit the 4 o'clock time right now. I would like to thank all of our presenters today for such an insightful and thoughtful presentation. I would like to thank all of you for attending this afternoon. This now includes our presentation. Enjoy the rest of your day and have a great weekend.